Dogs can develop various behavioural problems throughout their lives. Before we can address such issues positively, we must first be aware of their cause, the manifestations of behavioural problems, and what treatment options are available to us. Does your dog exhibit problematic behaviour? Do you know what to do about it? AnimalWised tells you everything you need to know, so keep watching. The appearance of behavioural problems in dogs has three main origins. Genetics. Studies show that genes directly influence the character of a dog, and it's not strange that a sensitive dog might have puppies with a similar character. Socialisation. Dogs which have not been properly introduced to animals, people and environments in their first 3 months are susceptible to behavioural problems as adults. Learning. Our dog observes and learns all the time. If they have learned that crying gets attention or that biting you leaves them in peace, they are likely to continue this behaviour indefinitely. Now you know why behavioural problems occur. How do they appear? We show you the 10 most common. Fear of dogs, people, objects or environments. Fear is not exclusive to dogs that have been mistreated. Fear takes many forms, from fear of individuals to fear of loud noises like fireworks. It can be more or less acute, but regular education is required to solve it. Separation anxiety. Separation anxiety is a disorder that occurs when a dog is home alone. Prolonged barking, bowel movements, urination, destructiveness and whining are common. It causes a state of generalized stress in the absence of a human guardian. It's a complex problem that often requires the help of a specialist. Destructiveness and excessive biting in puppies. Many people claim they have a puppy with behavioural problems. However, destructiveness and a strong bite are normal and acceptable in very young dogs. You should never scold a puppy for it. It's vital to understand they are in a developmental stage during which their discoveries and experiences are going to reverberate in their adult stage. They are usually simple problems to deal with if the whole family follows the same guidelines. Aggression towards dogs, cats, objects or people. There are many types of aggressiveness: protection of resources, aggressiveness due to fear, territoriality, predatoriness and more. It's a serious problem that requires the supervision and guidelines of a professional. Regular behaviour modification sessions are usually needed. Coprophagia. This is when dogs ingest feces. It is normal and common in puppies, but not in adult dogs. It can be complex to treat and evaluation by a veterinarian is necessary. Urination and defecation at home. Micturition must be differentiated from marking. These problems can be caused by other disorders such as fear, separation anxiety, the onset of puberty, excitement, health problems or cognitive dysfunction syndrome, a sort of Alzheimer's disease seen in elderly dogs. It is advisable to consult a veterinarian before starting the learning process again. Intolerance to touching or use of certain objects. This appears in dogs that have not been properly socialized or have had a traumatic experience. At first the dog usually tries to flee, but when it does not work it can begin to manifest in aggression. Excitability. Here we speak of effusive behaviours that the caregiver considers inadequate. Some examples are biting their collar or jumping on top of people. They are usually easy to correct. Excessive barking. Excessive vocalization is often caused by a behavioural problem such as separation anxiety, fear or aggression. Working on the cause of why they bark excessively is the way to treat the issue. Abnormal behaviours. There are other behaviours that should put a dog guardian on alert, such as stereotypies, which are repetitive and constant movements without an apparent purpose, refusing food, walking in circles and others. Thanks to the internet and the ability to access information, more and more mild behavioural problems in dogs are solved at home. It's important to only follow advice which can be backed up by research and ethological studies which support its effectiveness. We should completely avoid those not written by professionals, those which have no references, or which use punishment. In most serious cases, we need to seek advice from a veterinarian, ethologist, or canine educator specialised in behaviour modification. In any case, a specialist should ask for a veterinary review to rule out any underlying health problems which may be the cause, such as pain or hyperthyroidism. They can offer adequate diagnosis, present guidelines, and the possibility of behaviour modification sessions. Once again, avoid anyone who isn't qualified, who does not base their work on ethological studies, or who uses techniques incorporating physical punishment. Here's our video for today. In the description you can find some articles on behavioural problems we have discussed, and don't forget to share your experience in the comments. Give us a like if you enjoyed the video, and subscribe for more content to come. We'll see you next time.